What are some good things to know about the buccal and the rectal roots? And as usual, what are their pros and cons? Yes, these points will be scintillating head points to form the discussion content of today's episode. Welcome all to Is Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. As we are climbing the ladder step by step of the roots of drug administration, after oral, the next step is buccal, or in a better way, it's sublingual. You know, these terms are used interchangeably, but let me highlight the minute difference between the two. Sublingual means placing the drug under the tongue. Really, no doubts about it. But, buccal is in real sense. It involves the drug placement between the cheek and the gums. These are used interchangeably because the drug can be placed under the tongue, it can be crushed in the mouth. Both the ways, it spreads over the buccal mucosa. Okay, tell me, you want to count the benefits or you want to count the limitations of this route first? No confusion, we are optimists looking only at the rainbow colors among the dark clouds. Let's begin the epic details of advantages of sublingual drug administration. 1. Rapid onset of action. Quick absorption. Yes, it occurs within minutes. Things are happening in a twilight. Second, little discomfort is caused by the drug placement as the drug is placed under the tongue, or even the buccal placement is also causing a little discomfort. But no worries, you can spit the drug after you get the desired effect, or even after in any case. Unfortunately, you observe some side effects. The best part is not to be forgotten, the ease of the drug administration. Okay, third advantage to count for is the bypassing of the pre-systemic metabolism. What I call in a better known way as the first pass metabolism. Or in another way, portal circulation is bypassed. In all the ways, the drug directly reaches the systemic circulation. Let's not overlook the disadvantages. Yes, they are in every route. You just cannot overlook them. First and foremost, if the taste of the medicine is really bad, it's really your bad luck, If the drug is irritant, and then it's not the right route for this kind of a drug. Second, only well-suited low molecular weight drugs can be given via this route nicely. So there is no chance of giving drugs like high molecular weight, peptides. You know what I'm talking about? Yes, the insulin. Okay, now it's the golden time for the shining stars. Sorry, I mean to say the shining examples of the drugs for this privileged route. The first example are the nitrates like nitroglycerine tabs or isosorbide dinitrate tabs. They are very useful in the cardiac conditions like angina. Second important example I want to narrate is the liquefied nifedipine. It is used for instant treatment of the hypertension. After crushing the capsule, you can use it nicely. Next example, after crushing the capsule, systemic effects can be obtained. There are few more drugs like buprenorphine, dexamino-oxytocin, etc. Then there are antiseptic lozenges which can produce local effect if given via this route. To complete the final words about the enteral routes of drug administration, let's close today's talk after discussing the rectal routes of drug administration. Rectal route is the placement of drug through the rectum. It's a great choice, especially if the drug is irritant, if the drug is unpleasant, if the patient's state is nauseous, or if the patient is about to vomit, if the patient is unconscious, well, then you should better go for this route. 50% rectal region drainage, it bypasses the portal circulation. There occurs minimal biotransformation of the drug, and there are no chances of the drug being destroyed by the stomach or the digestive juices or enzymes. And for your no surprises, let's know the disadvantages. The route is quite inconvenient. It is quite embarrassing. That's so obvious. Drugs may irritate the rectal mucosa. Absorption sometimes may not be complete. Absorption can be a slow process, and actually sometimes you just cannot predict the absorption at all. As the liver is bypassed, especially when the drug is absorbed in the external hemorrhoidal veins, but if the drug is entering the internal hemorrhoidal veins, the liver is not bypassed, and that amount is around 50%. That may sometimes lead to rectal inflammation. Especially I'm talking when the drug is irritant. Good examples of the drugs for local effect production are the glycerine and the bisacodyl suppositories, or they can be in the form of enema, or they can be in the form of the ointment also. Then another type are the diazepam solution, paracetamol suppositories. They are commonly used, both are used in children. To obtain the systemic effects, aminophylline, they are used as bronchodilators. Indomethacin, they are used as anti-inflammatory agents. Then they are made as suppositories. And lastly, for your kind information, ergotamine is also given rectally. Now, to be really kind enough, it's the right time to pull down the curtains for today's episode. Before I really wave a final bye, a little blooper. What happens when your kids copy your casting skills? You wanna listen to it? Okay, here goes the bundle of childish, imperfect, cute kids copying mom's podcasting.
Welcome to my podcast. Today I will be telling you the dosage of drums and drums. So let's begin.
This was really hilarious. Hope it made you giggle for a while. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you are listening for the first time, do follow me here, whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.